I think ASCO 2014 was, for me, a very important ASCO. With the progress of the molecular biology, clearly the molecular characterization of the tumor is more and more present in many of the sessions. Clearly, immune function, immune biology, immune therapy is really going up and up in the meeting in general and in this ASCO in particular. And we saw very interesting data on immunotherapy. Of course, PD-1 and PD-L1 monoclonal antibodies are not new, but clearly the role in the treatment of tumor is better precise, and I think in the near future we'll see more and more information on that. The third things happening at this ASCO 2014, and for me is to some extent a revolution. We are speaking more and more about the value. What's mean value? This is a rapport between outcome and cost. And cost really was an important issue during this meeting. We presented several works here during this meeting. As you know, ALTO trial was presented by Professor Picard. Zephyr trial, which looked to the HER2 mapping of metastatic breast cancer and the role of early FDG PET to predict the sensitivity or the resistance to TDM1, was presented by Dr. Gebhardt at the biology session yesterday. I presented several work here during this meeting. I propose to summarize two of them. One in relation with new drug development, in particular a monoclonal antibody targeting the CD70, which is, let's say, a modulator of the immune function. This monoclonal antibody targeting CD70, the hope is to restore the immune function and to decrease the tolerance of the tumor. And so this was a phase 1 trial performed in 3 centers in Belgium, in Jules Bordet Institute, of course, in Ghent, with the principal investigator, Dr. Roté, and in UZA in Antwerpen. And so we showed that this monoclonal antibody is well tolerated, was administered, we defined the recommended dose, was given to several solid tumors, and we saw very interesting stable disease in many patients already progressing before to enter the trial. And interestingly enough, during the same session of poster discussion, there are other posters looking to the counterpart of CD70, CD27, monoclonal antibodies targeting CD27, showing exactly the same result. So that means we are already beyond PD-1 and PD-L1. We are looking to monoclonal antibody targeting other molecule playing a role in the tumor tolerance and to restore the immune function. The second work we presented here is a joint analysis of 2 important studies with eribulin, the EMBRACE trial and 301 trial. And we aim to see the overall survival data of the patient treated with anthracycline and taxane. And interestingly, we arrived to the same conclusion that the survival is improved by eribulin. Overall, in particular in triple-negative breast cancer as well, or more receptor-negative breast cancer, as well in patients who had more than 2 organs involved by the metastatic disease. So this is really a confirmation what we have by individual study, I mean by that EMBRACE trial. So the joint analysis confirmed that there are a survival advantage by giving eribulin compared to the best choice of the investigator.